Thank you all for joining us today. Before we begin, please remember to keep your microphones and videos off to avoid any distractions. You can submit up to 2 questions to the moderator by chat, and please submit your questions as clearly as possible with your name and outlet. Welcome, Mayor Breed.
Thank you. Good afternoon. I'm San Francisco Mayor London Breed, and as of today in San Francisco, we have a total since this pandemic began of 16,208 cases. Right now, there are 95 people who are hospitalized, and sadly, there are 162 people who've lost their lives because of COVID-19. Today is a really tough day. What we are seeing in our city, our region, our state, in our country is a virus that is taking over. Our cases have continued to spike. We are currently averaging 140 new COVID-19 positive cases per day compared to 34 per day that we averaged in late October. We were in a much better place back then. Our hospitalization rates are rising locally, especially in our ICUs right now. And just as importantly, hospitalizations are rising everywhere. So if we run out of beds, there won't be another county that can help us. Now, yesterday, the governor announced his new stay-at-home order linked to hospital capacity. We know San Francisco is not at that trigger point yet, as is also the case with most of the other Bay Area counties. But that doesn't mean we won't be soon, and that we should wait to act. If you're not working to stay ahead of this virus, you're falling far, far behind and very quickly. Our biggest fear all along, that we won't have a bed for you or your mother or your grandmother or grandfather when they get sick, is the reality we'll be facing unless we slow the spread. The measures we've tried so far simply haven't bent the curve the way we need it to. We have to do everything we can to prevent this from being a holiday season that we look back on as one of sickness and death, especially now when we have vaccinations that are really within sight. There is a light at the end of the tunnel. That's why today San Francisco joined with several of our Bay Area partners, Alameda, Contra Costa, Marin, Santa Clara, and Berkeley, to opt into the restrictions laid out in the governor's new stay-at-home order. We know that if we wait, we are just delaying the inevitable. If we wait 1 or 2 more weeks to have these restrictions placed on us, it will just mean our numbers will be higher and harder to bring down. Our goal should be to flatten this curve now. So what do these changes mean? Frankly, a lot. And it's hard and painful. Starting Sunday, December 6th at 10 p.m., the following activities will be required to suspend, The following services will be required to suspend operations until further notice. Personal services, including hair and nail salons, barbershops, tattoos, piercing, estheticians, massages, including outdoor operations. Outdoor dining, restaurants can still do delivery or takeout. Outdoor museums, aquariums and zoos, indoor gyms, drive-in theaters and performances, outdoor playgrounds, outdoor family entertainment centers, including skate parks, roller and ice skating rinks, batting cages, go-kart racing, and miniature golf must close. Open-air bus and boat operations. The following activities will be required to reduce indoor capacity. Retail. All retail establishments must reduce capacity to 20% and implement a metering system to track people coming in and out. This includes places like grocery stores, pharmacies, bookstores, clothing stores, and toy stores. The following activities can continue with modifications in place. Hotels may only accept a reservation from essential workers traveling for work purposes or to support critical infrastructure, including for isolation and quarantine. Small outdoor gatherings must limit themselves to a maximum of 12 people. Outdoor gyms and fitness activities limited to 12 people. Youth sport programs can continue with very strict social distancing and face covering guidelines. Home and apartment showings must take place virtually unless it is infeasible. And low contact adult sports like golf and tennis may continue. I don't want to do any of this. I know this means people's jobs, their businesses, their livelihoods are at stake. This is going to be painful, and we need to fight for any relief we can get from the federal government to get us through this. Our local businesses and restaurants need this help. And despite the fact that we don't have what we need in terms of federal support, they've been doing everything they can to keep their doors open, keep people employed, and keep our local economy going. So I'm encouraging you to continue supporting them. Shop and order locally this holiday season. Order takeout from your favorite restaurants. It's critically important to them. And it's a way that we can have an impact and help our community through this. It's going to be hard on families and kids, but our community learning hubs will remain open. The schools that are open will remain open. Elementary schools that are closed can reopen with a waiver, and we absolutely must continue our work to reopen our public schools. Look, I'm not immune from the stress that this pandemic has caused on people. As the governor said, this should be the last major surge we face. And it will likely be the most challenging because I know people are tired of this. I'm tired of it. But we are facing the reality that we won't be able to treat patients who are sick. People will die who otherwise would live. People will lose loved ones. This is perhaps the final test we face as a city in this pandemic. And we need to do everything we can to make sure we don't face unnecessary tragedy right before this is over. Now, I do want to address the issues about the restaurant I visited in Napa County. As I said yesterday, it doesn't matter if I wasn't technically violating local health orders, because I know that as mayor, I should hold myself to a higher standard. I understand that. My job just isn't to lead by the letter of the law, but to lead in the spirit of it. I understand that, and I'm committed to doing better. Look, this pandemic has been hard on all of us. There's no playbook for this. I know that none of us thought that in 2020, we'd be in the midst of a global pandemic. Who would have thought that this would have ever existed in our lifetimes? The impacts we've all experienced on our mental and emotional health have been tremendous, and that includes me. Every day I do this job, I think about the people whose lives I'm responsible for, that the decisions I make impact people's jobs and their families. And I'm doing my very best for this city. No one is perfect, and certainly not me. As I've said, the criticism I've received is fair, and I understand my responsibility, and I've learned from this moment. I want everyone to recognize that people all around you are trying. They are trying to follow the orders. They are trying to hold it together. We are all trying, and it is hard. People are losing it. But we can't lose it on each other. We can't turn on each other. This isn't about me. I can take the criticism. I wouldn't be in this job if I couldn't. But to your neighbors, to your coworkers, to the people you see walking down the streets, to the bus drivers, to our city workers, they're trying to keep us safe and healthy. So please have a little understanding. The coming weeks are going to be even harder than ever before. But what we can do is to make sure that we get through this safely. Also, we've received some very good news on our vaccines. They're coming. That means that there is, as I said, a light at the end of the tunnel, and Dr. Colfax will share more of that news. While our initial supply will be very limited, the rollout is beginning this month. I believe in this city. And I want to thank each and every one of you for what you've done so far. It has been almost a year, which has felt like eternity, of putting our lives on pause. It has been very challenging, and I do understand completely. And so I just ask for your patience, your understanding as we get through these final weeks of this challenging pandemic, so that we can really look back on this experience and be proud of what we've done to get our city through this. Now I'm gonna let Dr. Colfax provide an update on exactly where we are at this time. Thank you.
Good afternoon, and thank you, Mayor Breed, for your leadership and dedication to the people of San Francisco. Unfortunately, as the mayor has said, we are in our worst surge yet of COVID-19. It is stressing healthcare systems across the state and taxing our healthcare workers. I wish the people in the hospital now with COVID-19 a speedy recovery, and my condolences to the families and loved ones of those lost to COVID-19. Unfortunately, the current situation is likely to worsen. In San Francisco, every day now, 145 people in our city are testing positive for COVID-19. The virus is spreading rapidly throughout the city like never before. The increase in infections has been climbing for over a month now, and COVID-19 cases have quadrupled in that time. We need to move fast, keeping ahead of this virus as much as possible. And we need to make hard decisions to avoid a truly catastrophic possibility, not being able to adequately care for people who are sick. We need urgent intervention now to dent the trajectory of this surge, to begin to turn things around. We have a window, but we estimate that we have about 1 week left to try and stabilize the current flow of COVID-19 patients in our hospital system. That is just 1 week to slow this virus and ensure we can adequately care for sick people in our hospitals. That is why we decided, along with our regional partners in the Bay Area, to act quickly and aggressively to implement the state of California's stay-at-home order starting this Sunday at 10 p.m. We do not make these decisions lightly. We are here to protect our city, our neighbors, and our loved ones. We are here to save lives. First slide, please. I wanted to share this slide of what is happening across the state, because this is different from what happened in previous surges. For the first time since the pandemic began, every county in California is surging and hospital beds are filling up. When I look at this map, when we look at this map, we see our hometowns. We see our friends and family in as much trouble as we are here in San Francisco. We see that 99% of California's population is living in the purple tier with widespread transmission of COVID-19. In the last 2 weeks, COVID-19 cases in California have increased by 58%, and hospitalizations have increased by 82%. This means that when we in the Bay Area run out of beds to treat our sick patients, there will be no mutual aid. There will be no place to send them. we will be on our own and struggling to treat sick people. Next slide, please. Our San Francisco ICU intensive care unit bed capacity is quickly decreasing. We are in an extremely volatile position for our healthcare system. The red X's you see here at the top of the curve are the actual number of ICU beds occupied, and the blue line represents our projections. In the last month, COVID-19 hospitalizations have tripled. In the last 7 days alone, San Francisco's COVID-19 hospitalizations have increased by 35%. If we allow the virus to keep spreading at this pace, we estimate that San Francisco, across our 9 hospital systems, will run out of intensive care unit beds on December 26th. Moreover, at this rate, we believe that all hospitals will have a shortage of beds for any sick person. By January 4th, there will be approximately 200 sick people in San Francisco in need of a hospital bed. And if things continue on this trajectory, by February 4th, there could be 1,600 people in San Francisco in need of a hospital bed. And across the region, we estimate that some Bay Area counties, including Santa Clara, will run out of ICU beds in the next week. If this trend continues and we do not slow the spread of the virus, we will be unable to care for people in San Francisco's hospitals. And it's not only because of beds, but it's because we will not have enough nurses and doctors to adequately care for people. Remember that map of California. Unlike in previous surges, every hospital in California is under stress. There will be no place to transfer patients. There will be no other place from which to hire more nurses or doctors, which we would otherwise be able to do in a localized health crisis. 3/4 of the state's hospital beds are filled right now, and nearly 25%, 1/4 of them are filled with COVID patients. Please understand this. If or when you or your loved one, friend, or coworker gets sick, whether with COVID-19 or another condition that requires hospitalization, if this trend continues and we do not all do our part to slow the spread of the virus, and it hurts me to say this, but there may not be a nurse or doctor or hospital available to care for you. End of slide, please. This is why we are taking such aggressive action now. This surge is real, and it's happening all around us throughout the city. But we can do something about it. The health order initiating the changes Mayor Breed described will be issued today and effective Sunday at 10 p.m. We hope that these urgent interventions, coupled with other recent changes, can stabilize our current case count in hospitalizations. If we move now, if we move today, we still have a chance to stabilize our cases, keep our healthcare system functional, and save lives. We cannot let this virus get so far ahead of us that we cannot properly care for ill and the vulnerable in our community. We have done this before. We have beaten back 2 surges to prevent the situation that looms before us now. This time, it will be tough, but the alternative is unthinkable. And while there is a vaccine on the horizon, it does not help us with the current surge. And that is what I hope for, that we hope for, that we are all indeed here for the vaccine. This week, the state informed San Francisco that we will receive just over 12,000 doses of the Pfizer vaccine in the next 2 weeks. Initial vaccine supply will therefore be very limited. Vaccine prioritization and allocation is dependent on the decisions and timeline of the state and federal government. California is making sure that these first supplies are provided to those in direct risk of exposure due to their jobs in healthcare and long-term facilities, including nursing homes. This includes clinical and non-clinical employees, from the doctors and nurses to the food delivery staff and janitorial staff. The general population will not have access until the vaccine supply is no longer limited. And that is expected to be months after initial vaccinations begin. And while there is hope for a vaccine, we must battle back this latest surge. We need to pull together and protect our family, neighbors, and communities. We need to pull together for the person who breaks a leg, a hip, or has a heart attack and needs that hospital bed. For the essential worker who has no other choice but to work, the muni driver, the paramedic, the grocery clerk, the postal worker, the delivery driver, and our physicians and nurses. For the older adults who have sacrificed for so long the outings and visits with families and friends. For the shop owners who are trying to have a holiday business season. For those who have not been able to work and desperately want to get back, such as our hospitality workers. For the children who crave social interaction in environments of learning. For our local neighborhoods and communities that continue to carry a disproportionate burden of suffering in this pandemic. We are San Francisco, and we have led the world in our values during this pandemic. Let's show the world, let's show each other one more time that we can beat back this virus by working together. Thank you.
Thank you, Dr. Colfax and Madam Mayor, for your time. We'll just take a moment as questions are coming in. At this time, it seems we have a variety of healthcare related questions for Dr. Colfax. And whenever you're ready, Director.
I'm ready.
So the first set of questions are from Aaron Alday with the San Francisco Chronicle. How will you decide when to lift the stay-at-home order? Will it be in place through January 4th?
So right now, across with San Francisco and the regional order, the order is effective until January 4th, excuse me. And we will be looking at a couple of key variables with regard to lifting the order. One is we will need to see a consistent decrease in the rate of COVID-19 diagnoses and hospitalizations in San Francisco for at least 3 weeks. And we will need to ensure that we have at least a 25% capacity in our intensive care unit beds at the same time. So those will be the key variables we will be looking at to consider lifting this order. Of course, if trends continue and we meet the state criteria for going into their stay-at-home order, we would be subject to those state restrictions and what would be required to come out of those restrictions.
Thank you. The next question comes from Nam Kwok with KTSF. Will there be any coordination between the Bay Area counties in terms of taking care of ICU patients? For example, if city ICU capacity falls below 15%, Will other counties accept ICU patients from the city?
So since the beginning of this pandemic, we have been working across the state and across the region in terms of mutual aid. And in fact, when Imperial County this summer became overwhelmed with hospital patients, we accepted patients, including at Zuckerberg San Francisco Hospital. What's extremely concerning about this surge, as I showed, and as we know, this is a national, statewide, and regional surge. So again, the reason we're taking aggressive action now regionally and including in San Francisco is we are very concerned that all the intensive care unit beds and very plausibly the hospital beds in the region and the state could be overwhelmed and there will not be mutual aid available. This is a very real possibility, which is again why this surge is so much more serious than what we've seen before.
Thank you, Doctor. The next question comes from Juan Carlos Lara with Mission Local. What activities are most tied to new cases, and is that how these closures were determined?
So again, we know that the more we move around, the more we engage, gatherings, interactions, particularly indoors, the more likely it is that we will see a spread of the virus. So this action today takes aggressive steps to limit the spread of COVID-19 in the city. And we know for activities that do continue that it will be so important to wear those masks, socially distance, and use good hygiene.
Thank you, Director. And thank you, Madam Mayor, for your time today. That concludes today's press conference. For any other questions throughout the day, please email dempress@sfgov.org. Thank you all for joining us.